Troy, you mentioned earlier pharmacology, you mentioned labs, you mentioned imaging as some of those areas where within the Air Force, you received specific training to prepare you for those scenarios that come up where you might need to utilize some of those services. What are the criteria that you feel like in the civilian world and for the rest of us, should there be a postgraduate track work that you'd have to work through? Should it be, just like our other continuing education where we should be able to show that we've had this training, or could it be that we get that within DPT programs? Do you understand that that's already being provided? Talk about that for a moment.
Yeah, that's a great question. And just to back up a little bit, I also think when you look at actually at medical schools, at the musculoskeletal training that med students have, it's minimal to non-existent. They can actually choose as one of their clinicals or their rotations where they actually do some musculoskeletal stuff. Not all of the physicians will do that. So we're left with, there's a group that they're left to sort out these patients. And so I think that on the PT side of the house, I think in the interim, I think if we were to move forward, the plan that would work extremely well is to have some sort of a continuing education to get everybody up to some standard that's met. I think there's a lot of different ways that we could work this, to have some mentors within hospitals, within actually different facilities to run actually cases by and so forth. But I actually think what, in my mind, the way that we need to push this is that the PTs, when they graduate from a DPT program, they have had the opportunity to practice those practice privileges under the mentorship of a physical therapist that already has their credentials. That's the way it actually works in medical school. And I think that's the way that it should work for physical therapists. And then when we set for boards, all of those skill sets, they're involved in the boards that we have to pass. There's several different ways to do it. The UK, the way that they actually do it is the therapists, they graduate at the doctorate level, with the skill sets, but then as they advance in their career, they have some additional training they can take, which it'll designate them as a specialist in musculoskeletal care. And so that helps to give them a pay increase in the national healthcare system. Also, just it allows them to begin to really work just autonomously as well. So there's several different ways to do it, but I think that the easiest way, the cleanest way that would actually give us the standardization, at least in my mind, would be to do that through actually the physical therapy programs that are out there right now.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.